So when we were students, there were not many drugs to be used, just 2 or 3, maybe 4 at most. But now there's a drug resurgence, as I may call it, and all diabetic drugs, they cause weight gain. There have been drugs which are causing weight loss, which is a boon for a diabetic patient. That is one. Second, kidneys were the foe of diabetes. Now here we have drugs which make kidney the friends. The sugars goes out of the body and you lose weight, you lose glucose, sugars become better. And last but not the least, these are the very drugs which protect your kidney, which protect your heart over and above the sugar benefits. So actually we are in a very exciting era and more to come, but we now have drugs which control sugars and prevent complications as well. So what a wonderful thing to have actually. This is a very interesting question actually. So testosterone, a male hormone, has been overlooked over the years. But now we have enough data that testosterone actually improves the lipid profile. When I say it improves the lipid profile, it actually pulls down your bad cholesterol. The LDL levels go down and the HDL, which are the good cholesterol, goes up. Fine, there are contrasting studies. Some may say HDL, the good one, is not altered. Some may say it's altered. But on the whole, the ratio of the LDL is to HDL improves, and that would help our patients do better. Now, why does testosterone do that? It is an anti-inflammatory agent, which means it reduces the chemicals which worsen diabetes. Also, it is a chemical which enhances the metabolism of lipids. So on the whole, the cholesterol levels go down in general, and also the diabetes or the glycemic control may improve in the patient because the insulin resistance or the action of insulin becomes better in these patients. So testosterone therapy, no direct bearing in there, but what happens is that in insulin resistance in diabetes, insulin can't act the way it should. And therefore, the sex hormone binding globulin goes down. As a result, the total testosterone goes down, and I've just told you in the last question as to what happens if the levels go down. So any drug which increases the SHBG, how? By decreasing insulin resistance would help us benefit. So logically, metformin and glitazones should help us in that regard, but there are no direct trials doing that. There is just one drug called glimepiride, which directly increases the testosterone levels, and that would help us do better. There are trials to show that glimepiride also reduces resistance. That is one way it could. But a small trial of around 15-20 patients has proven that glimepiride increases the testosterone levels in males. So as I said, that the drug which is glimepiride is most appropriate. Now, as the age advances, the testosterone levels go down. And this is the very age wherein you would have the cardiac events, where you would have the metabolic syndromes. So hypogonadism, which that matches. So I think glimepiride is the only drug proven clinically to have some benefit in these patients, although one must understand it can cause hypoglycemia, and one must understand that it's a small study of 50 to 20 patients, so it might not be a large cohort wherein we could actually say that this drug should be given to all patients. But yes, there are some hints, subtle factors which say that glimepiride can be used. So EASD, well, it's always fun coming here because it's an academic feast. You have new trials up your way, and I do expect something on glucagon this time. But the one trial forward to is the verified trial, which would be presented here, and I'm hoping it gives us good results.